Zimbabwean nurses desperate to leave the country for greener pastures are finding it difficult to emigrate as authorities refuse to provide key documents. Nurses working in Zimbabwe's public hospitals earn the equivalent of less than $200 a month, which has forced some of them to consider migrating to countries like Canada and Britain where there are better opportunities. Speaking to the Globe and Mail, Agnes Masarira said she cannot afford to buy lunch at a government hospital in Mesvingo, where she works. She said, "It's like I'm a slave. I have no house, no car, and not enough to eat, yet I'm considered employed. I live with my brother. I can only afford second-hand clothes. My child has to watch me struggle every day." Masarira said for years she has visited health ministry offices to request the documents, but each time she was told that the officials who must sign the documents were unavailable. She said one official asked for a bribe of $200 to arrange her diploma, but she could not afford it. Last year the Zimbabwean government doubled the application fee for verification letters to $300 from $150, making it even more difficult for nurses to emigrate. The letters have become almost impossible to obtain anyway, even when nurses are able to pay the fee. Setfree Mafukits, a Zimbabwean nurse who emigrated to Britain in 2020 when the restrictions were not as tight, said, "It's a human rights abuse against the suffering nurses. People are being tied down by the government. It leads to corruption. Some officials are cashing in on bribes from desperate nurses. The danger is that we're going to have a group of very disgruntled nurses in hospitals and clinics, which is very dangerous for patients." Maitline Dubé, a 34-year-old nurse at a government hospital in Zimbabwe's capital Harare, said, "I'm just living from hand to mouth. Often I have to walk to work, about 4 kilometers, because I don't have money for transport, sometimes, with my nursing uniform on. I